Morale in the health service currently is at an all-time low.
But doctors say they've been left with no choice but to take action.
Doctors are having to strike with their backs against the wall. It's not something they want to do. We have faced a significant pay cut over the last 15 years of nearly 35%. So the workload, if anything, has increased, and we're effectively doing 3 to 4 months of work free of charge every year.
Since 2008, the real take-home pay of consultants in England has been cut by a staggering 35%. And that's before the impact of this year's soaring inflation. And this is the government's response.
Consultants would receive a pay rise of 6%.
Well, imagine the shock for the health secretary when he finds out inflation in July was almost 7% and food price inflation was almost 13%. So what he's offering consultants is another crappy real terms pay cut. And according to the Prime Minister, who thinks uncapping bonuses for millionaire bankers is a terrific idea, that's
a fair deal.
Working in the NHS over the last 15 years has become more challenging, more stressful and more demanding. There's absolutely no justification for the consultants of today being valued less than they were in the recent past. And after all the sacrifices they made to keep us safe during the pandemic, this is the Prime Minister's response.
So, today's offer is final. There will be no more talks on pay. We will not negotiate again on this year's settlements, and no amount of strikes will change our decision.
Well, let's be clear on this. What the Prime Minister is saying is that if they won't accept a crappy real terms pay cut, he's just going to impose it on them anyway. Well, absolute bollocks to that. Imposition is not a negotiation, it's bullying and it's intimidation, and that's just not how we do things in this country. And if that's not appalling enough, if they won't roll over and accept Sunak's demands, he actually plans to strip them of their democratic right to strike, force them to work against their will and allow them to be sacked if they refuse. Why are UK news shows not pointing this out?
So we've got to balance getting inflation down.
Well, again, imagine the shock for the Health Secretary when he finds out that according to the International Monetary Fund, it was rising corporate profits which were the largest contributor to Europe's inflation over the past 2 years, as companies increased prices by more than the spiking costs of imported energy, not NHS pay.
So, one of the factors that we have to consider, particularly at a time of high inflation, is if we do inflation matching pay rises, that can actually drive inflation further.
The worst thing that we could do domestically would be to significantly increase public sector pay.
Look, the most important thing we can do to help people is to control inflation. We've got to reduce inflation. That's what's making life difficult for nurses and for everyone else in the country. And a big part of how we are going to grip and reduce inflation is by having restraint when it comes to pay settlements.
On what planet can it be said wage rises for NHS staff are causing high inflation? They've all seen massive real terms pay cuts over the past decade. This argument, constantly used by the government to justify inflicting crappy real terms pay cuts on NHS staff, has been rubbished over and over again by most expert economists.